I think I'm live. Okay. Hi, good evening everyone. I'm Dr. Raman Polu. Uh, Today we started a initiative for NEET PG. We know that it is only 33 days to NEET PG, which is on August 30. So what we started at Medaffin is an initiative called daily discussion of MCQs, which will be posted in our Telegram channel. So for your information, this is our Telegram channel. Okay, so you can scan it and you can be part of our Telegram channel. So what we will do daily is, so let me put that, yeah, let me put that like this, yes. So what we will do daily is we will post around 20 to 30 questions in Telegram at intervals. Let's say we will start at 8 a.m. Let me. So I think my audio is right now, it is fine. So if there is any disturbance, please comment in the chat. I can adjust my audio. So most probably I might have slightly increased the audio. So I guess right now it is fine, right? Low voice. Okay. Now? Hi. Now can you guys hear my voice? Okay, thank you. Oh. Let me see if there is, why there is an echo. It is still low. Now can you hear, is there an echo right now? Echo? Hi Preeti. Any echo? Now it's good. Okay, cool. Okay. The whole concept is to keep around 20 to 30 questions per day at intervals. Let's say we'll start at 8 a.m. We'll keep on posting MCQs around 8:30, 9, and there will be no answer discussion. So you can see today we have posted around 22 questions, right? So it will not disturb that much, and also you, if you can participate, right, it will be like at the end of the session, that is say at 7 p.m. daily, we will discuss all the questions for about half an hour. Okay, so is there any echo right now? Because some of them are saying there is an echo. Can we get an answer in the chat? Is there any echo? I don't know how I can know that there is an echo. Voice is clear. Okay, cool. So yeah, sorry guys, like there is some disturbance happening. So we just want to make sure that you guys will hear my voice properly. So we will be posting important questions. So we today posted a normal questions which are memory based questions, but in coming 33 days we'll be posting only long form questions, which will be little tough. And these questions are picked up from previous year question papers and previous year topics. So if you can follow the channel for 30-40 days, uh, I can say that definitely you are going to get around 70 to 80% from these topics, and from no related to these topics. Okay, so long form questions, image based questions, and video based questions, these are the things we will be posting in Medaffin ecosystem telegram channel. And this is our telegram channel QR code. You can just scan it to enter the telegram channel. Okay, this on the top right corner. So like I said, we are not going to advertise anything. We are very clear about it. For 33 days this channel will be an advertising free channel. Anybody can come in. We will only post questions. We will discuss about the questions, and once the discussion is done, we will be sharing the questions and the discussion in a downloadable PDF form, so that you can just have a look at it and make sure that you will be following your subjects, and you will be getting benefit in 30 to 40 minutes of this online discussion. So I encourage you guys to join our Medaffin ecosystem channel. Okay, so without for wasting our time, let's go to the first question, which we have posted at 8 a.m. in the morning. Which of the following is most striking sign of breast cancer? So the options are pudgy orange, nipple retraction, puckering, and both nipple retraction puckering. So at one or other stage we will have these signs and symptoms. But what is the most clinical sign of breast cancer? The most common sign is called pudgy orange. I mean, pudgy orange is nothing but the surface of the breast will have indentation similar to orange. So it's a French term. Uh, this is the most common um, feature of a breast cancer, and nipple retraction, puckering, and all these things will come when the cancer stage is slightly advanced. And nipple retraction is more in certain types of cancer, not in all types of cancer. Okay, so the second question, which we had posted at 8:30 a.m. exactly. So you can see there is no discussion, no disturbance from 8 to 8:30. What is the drug of choice for diphtheria carrier state? So the options are amoxicillin, erythromycin, rifampicin, and tetracycline. There are four options, and these are actually very straightforward questions. I don't want to keep the discussion longer. If it is required, only we will discuss. But the answer is straightforward. It's erythromycin. Why the erythromycin is the drug of choice is it eradicates the diphtheria carrying state. So you have to give at least 7 days. This is the treatment of choice, and 7 days is the dosage time which is required to reduce the carrier state, so that he will not be spreading the infection to others. Penicillin is also an alternative drug which you can give. That is the second, or I mean, if there is any erythromycin related reactions, or patient has uh, issues related to use of erythromycin, we can always give menclobin. And if he has penicillin allergy, erythromycin is the drug of choice. Okay, now coming to the third question, a 12-year-old poorly controlled type 1 diabetes is hyperglycemic. Which metabolic change is most likely to happen? Okay, uh, it's type 1 diabetes, so it means like there is less insulin production to very minimal, no insulin production, right? So what are the options we have? Glycogenesis in muscles, increased protein synthesis, increased conversion of fatty acid into acetylcholine, and decreased cholesterol synthesis. So we all know insulin deficiency prevents glucose entry into the cells, right? That's what the insulin does. Whenever you have food, your gut starts absorbing, breaking down the complex carbohydrates into simple carbohydrates, and it will be absorbed into the bloodstream, and there will be glucose spikes. So these glucose spikes triggers insulin, and the insulin is released. It is released into the blood, and it increases, right? When the insulin is released into the blood, it drives the glucose in the blood into the cells. So if there is excess of glucose, it will be driven into the cells, so that it will be converted into fats, or it will be stored in the form of fats. uh, in type 1 diabetes, because there is insulin deficiency, the uh, glucose will not be transferred to the cells. So what happens is, despite by high blood sugar in the body, it behaves as if the cells are starving. So it will start the lipolysis. So lipolysis results in increased conversions of fatty acids to acetylcholine, right? So even the sugars are high, still there will be a fat burning. So that's the reason most of the type 1 diabetics are very thin and lean, and they tend to get into ketoacidosis very faster than others. So that's another story. Yes, so the answer is number C. Cool. So going to the next question, a 3-year-old boy has recurrent bloody stools, eczema, atopic dermatitis like rash, and platelet counts which are about 20,000, and with normal WBC count. What is the best way to establish diagnosis? So what are the investigations, or that can definitely establish that this patient is suffering from this particular disease, right? uh, we have the options like LFT and RFT. The second option is screening for wasp expression. Number 3 is antiplatelet antibody assessment, and number 4 is bone marrow aspirant. Okay. uh, Anybody who is watching the live session can answer this, and if yes, i- please give your answer in the chat. Anybody? Okay, no problem. So the answer is screening for wasp expression. So this is a classic triad sign in X-linked recessive immunodeficiency disorders, which results in decreased platelet counts, eczema, and petechiae, right? So it is called Wiskott-Aldrich syndrome, and there will be a mutation in wasp genes, right, which results in this kind of expression. So the answer is screening for wasp expression. So number 4 question, which is posted at 10 o'clock, is TB expression. Thanks for the answer. TB resistant to rifampicin, isoniazid, kanamycin, an injectable, and levofloxacin, a fluoroquinolone, is termed as multi-drug resistant TB, rifampicin resistant TB, extensively resistant TB, and none of the above. So from the question itself, you can easily say, right, it is resistant to rifampicin. So if it is only resistant to rifampicin, it will be called rifampicin resistant TB. It is resistant to rifampicin and isoniazid. So it means it is a multi-drug resistant TB, right? If it is also resistant to the regular TB drugs, anti-tuberculosis drugs, along with any additional antibiotic, let's say kanamycin, levofloxacin, which are actually given even to treat these multi-drug resistant TBs. It is called extensively resistant TB. So the answer is number C. I mean number 3 option, that is extensively resistant TB. So anybody got it right, or anybody guessed it? It is extensively resistant TB. Yes. Thank you. Hulk, thanks for coming again. Archu. Okay, cool. Let's go to the next question. Uh, a patient with psoriasis is to be started on acitretin. Which statement about the drug is false? Acitretin has a half-life of about 50 hours. So, what is the false statement in these things? So, we have to be very careful, because sometimes we suddenly see, we will not see that false, and we will try to uh, we will try to answer it based on whatever things we will be seeing it, like acitretin, and we will see, okay, acitretin has half life of about 50 hours, and we'll just put it. So false is the important term which you should be aware of, and the reason why it is important is the answer belongs to that particular term, right? It's not about acitretin, it's about the question. So read the questions correctly, don't be hasty, complete your question, understand it, then answer. That way, you will stop yourself before answering. In exam you will be in hurry state, so try to not do that. Okay. Hi Pratik, it's like 20 to 25 questions per day. That's what we are trying to do. So you can join our Telegram channel. We will post like at every half an hour in Telegram channel, and at the end of the day we will be discussing. So today we are discussing only small portion which are mostly memory based, but in coming 30 to 33 days, 32 days, we'll be posting long form questions, image based questions, and video based questions. So this is our channel. Please look into it, and please join our channel. Thank you. So the second option is it can cause increased sensitivity to sunlight. Female patients should avoid getting pregnant for 6 months after therapy. Close monitoring is required in patients with hyperlipidemia. So what is the false statement? False statement is actually C. So why it is false statement? Because like the total period which she should avoid pregnant is around 3 years, not 6 months, because it is highly teratogenic, and the chances of getting congenital anomalies or missed abortions are high in these kind of cases, like a patient who is on treatment, and if she becomes pregnant within like 1 year, the teratogenic effects of this acitretin is very high. Okay. Anybody got? Okay. Thank you. Thanks, Archu. See his answer. Let's go to the fourth question, which is an image based question. Okay. Yeah. I hope you guys can see it. A man with an acute painful red eye, mid dilated pupil with shallow anterior chamber, refractory to medical and surgical treatment, undergoes drainage procedures shown. Okay. Identify the device. So I'll just click on it. You can just see it. Okay. So identify the device. So if you can see, it is placed exactly in this area, and how it helps is it will help decreasing the pressure IOP by draining out excess liquid. Okay, so what it is called, is it the express implant? It is trademark Ahmad glaucoma wall, Burbolt implant, or Maltino implant. Okay, so it is like, from the image we can say it is express implant. So this all these questions will be discussed again during our in our platform. It's Medaffin, so you can also visit our platform. It's called medaffin.com, uh, where experts has discussed about these topics. Okay, coming to the next question. This is the next question, and this is also an image based question, right? Coronary disease patient with chest pain and palpitations has ECG shown. The next step in the management is, if you can see the ECG, let me just, I don't know, you guys can see it. I guess it is fitting out of the window. Okay. Okay. So it is actually wide complex tachycardia. Okay, wide complex tachycardia. Patient is stable. So what will be the next step? Any stable wide complex tachycardia, the immediate wide complex tachycardia, the immediate treatment of choice is intravenous amiodarone. Okay, if it is a unstable case, what will be the treatment? So it should be cardioversion. Okay. Coming to the next question, which is posed at 12 o'clock. Klumpke's paralysis or lower brachial plexus injury characteristically produces which sign? Okay, so policeman tips is actually another name for abs paralysis. Like, the hand will be kind of in the external extended position with internal rotation at shoulder, and it looks like, I mean, it's mostly common in children when during the vaginal delivery, and there is shoulder dystocia, right? Second is wish drop. Number three is claw hand, and number four is Horner syndrome. Okay, so Klumpke's paralysis. Klumpke's paralysis is called, like, the, I mean, it is, its telltale feature is claw hand. Okay. Okay, any comments? Anybody there who is giving answers? Or if somebody is watching, please give us, a heart, or 100%, or some like. Okay, thank you, thank you, thank you. It means like people are there. Thank you. Good. Uh, I encourage people to join our channel, this Medaffin ecosystem. We will not stop here. We are building the channel for healthcare professionals around the world. So it's a slow start, but we are planning to make it a bigger thing in coming future. So yes, let's go to the fourth next question. Which section of Indian Penal Code, now it is actually BNS, it's not called IPC, it's called BNS, so the question is wrong, covers causing abortion without women's consent? So the sections are pretty much difficult to remember, but these are pure memory based questions. So I suggest to have a read regularly. Then you should have a spaced repetition, right? You read it, then you just close it, go away, try to remember what you have read, right? Then again go and read it. So these kind of memory based question, if you do spaced repetition, your memory will improve and you tend to remember it, because your brain starts thinking, okay, this point is very important, and this guy is, this guy or girl is trying to read it multiple times, so that I should remember it. So spaced repetition is one of the most important. Yeah, thanks with it. And yeah, so space repetitions is one of the important uh, exercises you should do to make sure that you will have this memory based questions instantaneously coming to your mind when you see that question. Yeah, thank you all, thank you. So the answer is section 313. So now it is BNS 313. Okay. So what is section 312? It covers miscarriage with consent. 314 covers death caused by an act to procure miscarriages, and section 315 covers preventing a child from being born alive. Okay. Yeah. No problem. I'm getting good response from even friends. Oh, yes, let me send my regards to my friends. Yeah, thank you. Okay, so like I said, memory based question, space repetition. Read it, close it, go out, have some tea, try to remember it, come again, read it again. So do this repeatedly. Okay. Today we try to keep all memory based questions, because today is our first day, and tomorrow onwards we'll curate mostly long form questions, mostly like questions which involve 2 to 3 departments, like multidisciplinary approach, so that you will have more you will feel better, right, when you attempt the exam. And I feel like this time every section will have long form questions, and every section will have image based and video based questions. I'm just expecting somewhere around 8 to 9 image based question, 2 to 3 video based questions, and at least somewhere around 18 long form questions or hard questions, so that they want you to test your time management capabilities, right? So that's very important thing. Cool. So the next question is bull neck is characteristically, sorry, there is some sometimes I pronounce wrongly because I do have lisp, so I don't so there's a reason I started the YouTube channel and I ended it, because like always in the back of my mind, I feel like, okay, I cannot pronounce it properly, but it's fine. You should start speaking, and that's the only way you will improve, right? So you should lose your inhibitions. Cool. Yeah. Bull neck is characteristically seen in a measles, mumps, diphtheria, and torticollis. Okay, it's memory based. So yeah, it's memory based. So it's diphtheria. So I'm getting a lot of messages also. So it's like gross swelling of your neck. Okay, the reason of this gross swelling is because your cervical lymph nodes are enlarged because of diphtheria. Okay, so it's an enlargement of your and lymph nodes along with the edema, which looks like as if you have a big neck, a very strong stouty neck. So that's the reason it's called bull's neck. Okay. Next question is, when sodium or potassium ATPase fails, cells accumulate sodium, calcium, and chlorine, and water and lose potassium, and a Gibbs-Donnan equilibrium develops. Okay, Gibbs-Donnan equilibrium develops. This equilibrium is mainly due to which intracellular component? Okay, so what is this Gibbs-Donnan effect? Uh, this arises because cells contains I mean, when you go into the molecular structures of a cell has more of protein, right? And these proteins are actually non-diffusible, right? And they have organic phosphates which are actually anions, right? It has like more of anionic things. So the answer is this equilibrium mainly develops due to which structure? It is simple like proteins. Which of these things cannot be permeating the cell membrane from intracellular to extracellular is protein. Calcium can easily go, phosphate can easily go, but bicarbonate can easily go, but proteins, they cannot go unless the cell ruptures, right? If there is a cell rupture, then there will be protein which is leaking into the stream. Cool. Okay, so the next question is misincorporation of uracil into DNA occurs in the deficiency of which vitamin? Okay, so options are vitamin B12, folate, vitamin B6, and vitamin A. So this is also a memory based question. Okay, answer is actually the folate. Okay, these folates provide usually 1 carbon units for methylation of D. Sorry, I'm getting called. So they convert the DUMP to DATMP, right? The folate deficiency will result in failure of these mechanisms, and uracil will be misincorporated into the DNA. Okay, in place of thymine, and it will cause actually damage to the DNA, right? So that is a important reason, and this can be avoided by supplying folate in people who has vitamin deficiency anemias. Okay, that is anemias or changes which leads to genomic instability. Yeah. Okay, what is the next question? I guess, I hope you guys are seeing. Okay, cool. So this is our channel. Please join. We'll be like posting, and the questions will be prepared by our experts actually. So uh, I encourage like we keep on growing. Thank you. Okay, coming to the next question. Which agent can be safely prescribed for open angle glaucoma in a patient with bronchial asthma? Okay, the answers is, I mean, let's study the options. Is it gemiprost, timolol, mannitol infusion, or latanoprost? Okay, so it is also a memory based question. The answer is actually latanoprost. It's an prostaglandin F2 alpha analog. Okay, it lowers intraocular pressure by increasing. 1 minute. Sorry, I'm getting this thing. It increasing the uveoscleral aqueous outflows. So that way it reduces the intraocular pressure and thereby reducing the symptoms, right? If any other medication is given, it will actually exacerbate asthma, and mannitol infusion may not be a correct answer, and it has more systemic effects. Yeah. Coming to the next question, which is Which of the following is not a feature of keratoconus? Okay. The answer is Hap's Munson's sign, irregular astigmatism, and scissoring reflex. If you go to the keratoconus, you can see Munson's sign, irregular astigmatism, and scissoring reflex. So, which is not a feature, then answer is obviously Hap's is like mostly because of uh, a structural abnormality in Descemet's layer of cornea. Okay, cool. Next question is, let me just get that. Yes, okay. A male infant with urinary retention has bilateral hydronephrosis and recurrent UTIs. The probable diagnosis is, and this is very common in children, right? Like when a young child is coming, especially male child, or is coming repeatedly with urinary tract infections, or you can say like whenever he urinates, he cries, right? That's a telltale sign, and you treat him, and after some time he will come back again, right? uh, yeah like it's a telltale sign. So you treat him, he comes back, he gets better, then after some days, like maybe there will be some triggering factor, and that triggering factor again causes UTI, and it is these children will have classically this posterior urethral wall, like the you when the child is born, the urethral wall should automatically, like the posterior urethral wall should not be there, right? When it is there, obviously it causes obstruction and sometimes damage, resulting in uh, urinary tract infections, especially in males. And these posterior urethral walls can also cause bilateral hydronephrosis also, like because there is an obstruction to outflow, and it results in back pressure, leading to bilateral hydronephrosis also. Yeah. Okay. So the treatment is also like they should get it treated properly. Otherwise, I mean, surgical treatment is the option. Yeah. Coming to the next question. A patient with 50% burns develops a burn site infection. The isolate is a strict aerobe, okay, aerobe and anaerobe, right? And the test shown in the image is positive. What is the likely organism? Okay. Uh, Burns, the most common, like one of the most common infections is actually one of these organisms, right? And the test, the it's a oxidase test, right? So oxidase positive test, right? So a aerobe, which is oxidase positive, and it also produces a diffusible pigment such as blue green pyocyanin and pyoverdin, is actually Pseudomonas aeruginosa. Okay, and it is Pseudomonas aeruginosa is also yeah. Yes, Shakil. Yes, Shakil, thank you, thanks for the answer. uh, Pseudomonas is also like it also causes multiple other infections, not only in burns, even intubated patients. We do always in a critical care, right? Pseudomonas is one of the important organisms which should be properly tracked and treated, right? Okay. uh yes guys, like I said, this is our channel, Telegram channel. Okay, so we will be posting everyday questions, no advertisements, no selling, only questions till NEET exam on 30th. So every day we'll be posting around 20 to 25, maybe 30 questions from tomorrow onwards we'll be posting more on long form questions and image based questions, right, and video based questions. So please join our channel. Every 30 minutes we'll post, every 30 minutes or 20 minutes we'll post a question. We'll not give the answer, and the answers will be discussed in the evening. And we are expecting some experts also to join. Thank you. Thanks, Preeti. Recent updates. Yes, recent updates. Yes, we will also post video based questions. That's the important thing, right? That's the recent updates. Okay, the next question is, please join our channel. This is the channel. You just scan it, and if you want I can also post. I don't know whether I can post it. Let me just, yeah, I can post it. Copy link. Yeah, this is our channel link. Please join our channel from the link also. Thank you. Okay, where are we? Yeah, a woman on oral contraceptive pills starts anti-tubercular therapy and is advised to add a barrier method. What is the reason? Okay, it's actually drug to drug interactions, right? We call it DID, drug to drug interactions. Okay, I mean DDI, not DID. Sorry. You use one drug, suddenly some because of a treatment or some other issues, like you may be introduced to add another drug. So when you start using the second drug, the efficacy of the first drug either it will increase or suddenly decrease, so leading to drug to drug interactions, or you can always say that it is not effective, or it is like causing, it is more effective so that it is causing more side effects, right? So that's the reason why your treating physician will always ask the patients, right? The physicians will always ask the patients, what drugs are you on? So for patients we always say, right, like you should not lie that you are taking some drugs, right? So the reason why she should be taking another barrier method, so there are other barrier methods, like we all know IUD, or uh, barrier methods, like maybe she should use I mean male partner should use condoms or anything like that. The reason being, rifampicin increases the OCP metabolism, so oral contraceptive metabolisms, which may result in failure of this. The main reason for the oral contraceptive is to prevent pregnancy, so it will not work if the OCPs are not working. Definitely, there is no point in using them, right? You can, for the safe reasons, you can always actually use a barrier method which is effective along with OCP. So the answer is rifampicin, and the mechanism is cytochrome P450 enzyme, right? So they will induce more cytochrome P450 enzymes, which increases the metabolism of oral contraceptive. Okay, coming to the next question. So this is our question. Actually, this is a video based question. You can see he is pressing for a long time, and you can see there is some blanching, right? Slowly turning into normal color, slowly turning into normal color. So the question is, during a postmortem examination, pathologist presses firmly on the area of purplish discoloration shown in the video, right? And it blanches and becomes normal. Shift means it becomes normal again. I mean, not normal, it turns again back into the purplish color. So what does this finding indicate about the time since death? So I have the options. I mean, this, like, people can answer. Death occurred more than 24 hours prior, indicating advanced internal decomposition. Lividity is fully fixed, indicating a postmortem interval of 12 to 24 hours. Lividity is unfixed, indicating a short postmortem short postmortem interval, typically 6 to 8 hours. The finding is an antemortem contusion, confirming the presence of mechanical trauma. Okay, so if you see, lividity is actually like when person dies because of immobilized state, his fluids, especially blood and everything, will collect in the more towards the ground. So just due to the gravity and the reasons, right? And the time from the death and the fluid collection will start, will have a correlation. I mean, there are two things, like time from the death, fluid is collecting at the gravity lower levels, and whether the fluids, I mean, when it collects, it discolors the body on the backside or the place where actually he's lying. Or maybe if he's lying on the front, it will be discolored in this area. If he's lying on the back, it will be back. It will be side, like so. Obviously, lateral side, it will be on the arm which he is lying on. So what happens is the pigments will break, the pigments will get fixed based on the time. Let's say if he's there for longer time, then you cannot displace the pigments, I mean the pigmentation. Okay, if it is lying, he died and he is there for like 6 to 4 hours or 4 to 6 hours, 4 to 8 hours, then there is a chance that you can displace the fluid from the discolored area. So here you can say that like he is displacing the fluid and the fluid is coming back. So that's the property of fluid, right? Like if it is not broken, if it is properly there, so when he tries to press it, the fluid will go out. When he tries to when he releases it, the fluid will come back seeping in, leading to the area will getting the same discoloration, purplish discoloration. So the answer is actually 6 to 8 hours. If it is more than 12 hours, usually even if you presses, the color will not change. And the answers in death, I mean internal decomposition and this don't have any relation. Okay, coming to the next question, which is image based question, right? A woman with a history of peptic ulcers presents in shock with abdominal distension. Chest X-ray is shown and identify the condition, right? So you can see, I mean, I don't know if you can see, yeah, you can see the diaphragm and liver is separated and there is a air pocket. And the question is saying that she is a peptic ulcers patient. It means like she has peptic ulcers, and one of the like complications of peptic ulcers or duodenal ulcers is they will perforate. Okay, perforation leads to accumulation of gas in the peritoneum, which it should not be there. Like it should not be there. And any gas in the peritoneum, usually it escapes when people are standing, right? Like upright, when they are walking upright, they will escape and they will be actually between the visceral organs and the diaphragm. So what are the visceral organs? The visceral organs are liver and spleen, and they will trap between the diaphragm and these visceral organs, right? So the one of the telltale sign is like when you do the percussion, you will get a not a dull note, you will get a higher like sound note at the areas where the liver and spleen should be there. And when you auscultate, there will be no breath sounds in that area. So that's the examination sign, right? Examination findings, right? So what will be the treatment? Obviously you need to do open laparotomy and close everything, and like keeping them in proper antibiotic therapy, right? It's one of the common causes which we usually find in yeah, yes, surgical treatment. Thanks, Dr. Tushar. Thank you very much. So perforation peritonitis, I mean options we already know. The answer is like perforation peritonitis. Pneumothorax, pleural effusion and hydropneumothorax will not be appearing like this. Let's say pneumothorax, it is more like the lung markings will not be there. I mean, the same dark shadow will be somewhere in this area above the diaphragm, right? Not below the diaphragm. And pleural effusion, obviously, it is more, opaque, not black or dark, right? And hydropneumothorax, it's a combination of both, right? So the answer is obviously perforation peritonitis. Yes, thank you guys. Thank you. This is our channel. Please follow our channel. Uh, as we say, this is only for medical professionals who are willing to be part of a bigger thing, right? So every day we will post around 20 to 30 questions. No advertisements, no selling, only questions, and we will discuss every day at around 7 p.m. Thank you. So if you can see, like, only questions, nothing posted. Uh, Coming to the next question, which lens prescription is appropriate for simple myopic astigmatism? Okay, so is it -1, +1 into 180 degrees, +1 ds, or -1 dc, right? Like 180 degrees. The answer is sorry. Okay. Yeah. So -1 ds. Yeah, correct. So the answer is -1 ds. And Shiv, Dr. Tushar, thank you. Thanks for the answer. Yeah. So the answer is -1 ds. The next question, we will go to the next question. Let me just open. I think you are able to see it. Let me just. Can you see? Yes. This is our last question. A man opens his eyes to pain, speaks inappropriate words, and withdraws, flexes to the pain. Sorry. What is the GCS? Okay. So we do have a scoring, right? It is like uh, yeah, yeah. Thanks, Dr. Tushar. It is E2V3, but like he's flexing, right? He is not spontaneously moving, right? So E2V3 M4, I guess. Like if he uh, spontaneously moves, then definitely M5, right? So E2V3 M4. Yeah, thank you. So GCS is one of the important things which we should document. The reason being, like, anybody who is in emergency, they will say, like, if somebody suspects a stroke or unconscious patient, the consultant, like when you are working as an emergency physician, the consultant or the other specialist usually asks a GCS. And there is also legal requirement, right? Like you have to note down what is the conscious level of the patient, whether he is improving or deteriorating. Okay, that changes a lot of treatment protocols, whether you should intubate the patient or whether it is safe to do non-invasive ventilation for the patient, right? So yeah, that's it guys. Thanks for joining. Thanks, Dr. Tushar. Yeah, please join our channel. Yeah, so I would like to also inform, like, this is our channel. uh, this is our Medaffin ecosystem channel. Those who joined late, I would like to introduce myself again. I'm Dr. Raman Polu. I'm working in UAE, Abu Dhabi for last 9 years, and I am a founder of tech startup. It's called Arupa AI Private Limited. One of the initiatives we are trying to bring in is this Medaffin ecosystem, where we are trying to unite healthcare professionals under one roof so that they can benefit from various initiatives, right? That's our main motto. And this Medaffin ecosystem will be our main channel, where we'll be broadcasting our future programs and all. Okay, the channel is purely for educational interaction purposes. So please join the channel, and we will be always like, we'll try to do a lot of ask me anythings, and we will also conduct the next 33 days we will be conducting NEET related campaigns. So please inform if if please join, and also share to any of your friends, juniors, or colleagues who may be interested in these kind of activities. And if you are interested in teaching also, you are welcome. We are open to various you know experts who are willing to give their expertise to fellow healthcare professionals. Yeah, thanks for joining. Thanks, Dr. Tushar. Thanks, Shiv. Thanks, Shakil. Thanks, Preeti. Thanks, Achu. It is nice. We will meet tomorrow again. So every day we will be doing it at 7 p.m. We will be posting questions in the Medaffin ecosystem channel from 8 a.m. till 5 p.m. and we will discuss at 7 p.m. This will be our standard 20 to 30 questions, long form questions from tomorrow, image based questions, video based questions. Thank you. Thanks, Hulk. Thank you very much. Thank you. This is our channel. Please join our channel. Thank you very much.